Hi, my name is Dr. Ben Yonker. I'm a neurosurgeon at St Vincent's and RPA hospitals in Sydney. In this video, I want to talk about what are the treatment options for trigeminal neuralgia. So initially when trigeminal neuralgia is diagnosed, it's typical to go onto medical therapy, and medical therapy usually involves medications that are anti-epileptic medications. The classic one is carbamazepine. Over time, what tends to happen is the pain episodes tend to get more frequent and more severe. And at some point, either the pain is breaking through that medication or the escalating doses of the medication are leading to side effects which can be intolerable for the person. Now, you can try other medication options or even multiple medications together, and sometimes these can lead to significant improvements in the side effect profile, but not always, and partially because the medications kind of work in the same manner as each other, that there is an inherent trade-off between dampening down that hyperactivity in the nerves with the medication and getting relief from trigeminal neuralgia. So what next? Well, there are three main surgical options for trigeminal neuralgia. The first is microvascular decompression. This operation involves making a cut behind the ear and going inside the skull to where the trigeminal nerve is being compressed by the little vessel or little artery that is causing the irritation to the nerve and making that nerve hyperexcitable. When we're in there, we take that little artery and we swing it out of the way of the trigeminal nerve to ideally take all of the pressure off the trigeminal nerve and then hold it out of the way with a tiny piece of Teflon felt, usually. This operation is a fantastic operation because if the patient has a typical history of trigeminal neuralgia, the probability of this operation completely curing the pain is 85 or 90%. And in most patients, they will be cured for good, although a few percent of patients will have a recurrence in the first year, and about 1% per year will have a recurrence ongoing in their life. It is a proper neurosurgical operation. There's a window made in the skull, there's a stay in ICU for one night and a couple of nights in hospital, typically after that. And so there is a recovery period that's associated with that operation. Most patients won't end up with numbness in their face. That's not a typical part of this surgery. So most patients after they get over surgery will be neurologically normal and be pain-free and usually very happy. Another option for treatment of trigeminal neuralgia is something called a percutaneous trigeminal rhizotomy. It's a bit of a mouthful. What this involves is passing a needle through the cheek up towards the base of the skull where the trigeminal nerve is coming through and actually inside the base of the skull. Something is then done to deliberately cause a measured degree of injury to the trigeminal nerve. And this might take the form of a balloon. So we do balloon compression of the trigeminal nerve. We also do radiofrequency, and radiofrequency refers to heating up the tip of an electrode to cause a little burn in the nerve. And the other method that we can do this is with glycerol, which is something that chemically injures the nerve. These procedures aim to create some numbness in the face. That's actually the intention of these procedures. And they're aiming to cause enough injury to the nerve that hyperexcitable nerve that you have in trigeminal neuralgia just can't get excited anymore, and hence the trigeminal neuralgia goes away. The important thing to know is that if you wake up from one of these procedures with numbness in your face, it's not an unexpected side effect of the procedure. It's actually the method by which we're achieving our goal of making people pain-free. And there's generally about an 85 to 90% success rate initially of patients becoming pain-free, but this procedure wears off over time. So with balloon compressions, the average amount of time somebody might be pain-free is often 2 or 3 years, rather than, for example, with the microvascular decompression, where it hopefully will be for a lifetime in the majority of people. Another option for management of trigeminal neuralgia is stereotactic radiosurgery, or Gamma Knife as it's sometimes called, based around one of the machines that is known for doing this treatment. Stereotactic radiosurgery involves shooting multiple very fine radiation beams onto the trigeminal nerve. Because they all come from externally, but are very precisely placed, this can be done as an outpatient. It's not invasive. Patients who are on warfarin or other blood thinners don't need to stop their blood thinners in order to do this procedure. And it can be completed in an hour or an hour and a half typically. This procedure doesn't work straight away. It typically has a lag to its onset of effectiveness, and that lag has a median time of about 4 weeks. It's a little bit less of a potent way of causing intentional injury to the trigeminal nerve than the percutaneous procedures are, and so it's, because of this, slightly less effective. So about 3/4 of patients will obtain significant benefit, but it's only about 50-50 that patients end up totally off their medication with this treatment as compared with some of the other treatments. It also does wear off over time, so there is a average expectancy of 3, 4, 5 years, but then the pain will typically return. In terms of side effects, it is very low risk, the main potential issue being the possibility of some altered sensation in the face. It's not usually a dense numbness, but it can be, for example, a crawling sensation or some sort of altered sensation like that. And it's about 30 or 40% of patients who undergo radiosurgery that have that. So how do you decide which procedure is the right procedure for you to have for trigeminal neuralgia? Well, remember that this is a general educational video, and these are some principles that I use, and that your specific situation needs to be discussed with the doctor who's going to be treating you. However, having said that, most patients who have trigeminal neuralgia, it will be due to a blood vessel that's pushing on the nerve. And I think for most patients, microvascular decompression is the preferred option, as long as they're healthy enough to go through an anaesthetic. The reasons that it's the preferred option are that although there's a bit more of a recovery associated with having a general anaesthetic and this operation, most patients will be completely pain-free. The majority of them will never recur in their lifetime. They don't get numbness on their face, and they can essentially get off all their medication and resume a normal life in the majority of cases. Percutaneous trigeminal rhizotomy is very useful in patients who don't have a blood vessel pushing on their nerve, so patients with multiple sclerosis, for example, or sometimes patients with recurrent trigeminal neuralgia who've had a microvascular decompression or just have trigeminal neuralgia with no blood vessel, as we occasionally see. This procedure does create some numbness in the face, and so it has to be understood that you're happy to accept that you're trading your numbness, your facial pain, for some numbness, and that you know that it'll wear off over a period of time and you may need to repeat it. There have been some patients who are just at a point in life where they can't take the time off for a microvascular decompression, and so some of those patients have chosen to have a percutaneous trigeminal rhizotomy, including a couple of ladies who've been pregnant at the time, for example, when I did it. The third option is the radiosurgery. Radiosurgery is a really good option for people whose pain is at a level where they can kind of just live with it at the moment, but they're looking for improvement in their pain. It's not great if you're in a situation where you can't eat and drink because the pain is really severe and you're in a really bad way, because it's just slightly less effective than the other alternatives and it takes some time to work. So I'd say that radiosurgery is an excellent option in people who want something very minimally invasive, but not patients who are in an extreme situation at the time. Well, I trust that some of this information has been useful for you in determining what treatment you want to elect for your trigeminal neuralgia. Remember, this information is of a general nature and the specifics of your situation need to be taken into account, so I suggest you discuss your own trigeminal neuralgia with an expert.